Big city medicine in a small town atmosphere. The opportunity to practice the full spectrum of family medicine in a modern, busy trauma and maternity center. A program where teamwork, camaraderie, and family are valued alongside quality and medical expertise. That is the Floyd difference. The Floyd family of healthcare services has been serving the people of Northwest Georgia and Northeast Alabama for more than 7 decades. Founded in 1942, Floyd Hospital was born of a vision when a group of men who dreamed of an accessible community hospital for their neighbors in Floyd County set out to make their dream a reality. Today, Floyd Medical Center is a medical hub with nationally recognized centers of excellence in bariatric surgery and breast care, and programs of distinction in knee and hip replacement, diabetes care, stroke care, and spinal surgery, and the Floyd Family Medicine Residency program that continues that original vision of community-based, accessible, quality health care.
The goal of the residency program is like all programs at Floyd, and is designed to help us fulfill the mission of Floyd. Specifically, graduate outstanding physicians that stay in our communities and meet the healthcare needs.
It makes sense that Floyd would also be home to a premier family medicine program. From its visionary beginnings, Floyd has grown into an award-winning healthcare system that includes a 304-bed acute care hospital, a 25-bed critical access hospital, a 52-bed behavioral health facility, and a network of primary care offices and urgent care centers, continuing this commitment to the families in our service area.
The residents are an integral part of the healthcare delivery system here at Floyd. Not only do they take care of a lot of hospital patients, they also each have their own patients that they follow for 3 years while they're residents here.
The Floyd Family Medicine Residency Program is unopposed, offering residents a very special opportunity for a comprehensive postdoctoral education to help them grow in all facets of healthcare.
When you're on pediatrics, you are the pediatric resident. When you're on OB, you are the OB resident, as well as in the adult medicine services. So they really get to do all the procedures and get to see all the patients.
I wanted somewhere that when I was done with residency, I could go back home to my tiny 35-bed hospital and be an awesome family physician. And certainly Floyd has more than met my expectations of being a wonderful small-town community hospital with all the amenities that I would find in downtown Atlanta.
As a family practice resident, you get exposure to every facet of medicine. You're going to do OB, you're going to do surgery, you're going to do emergency procedures. You're going to get a little taste of it all.
I came from a program where I saw the family residents were competing with other residents for procedures, for deliveries, for the good cases in the ER, and to come to a place where the ER physician will call me and tell me to go downstairs to come see an interesting case that he hasn't seen in a long time, or to try and work something up that he doesn't know what it is and he'd like for us to admit it. It really means a lot to me to know that we are treated like physicians.
This program is extremely hands-on. You can do as much as you want to. And it's not only our attendings that are fantastic about it, it's the specialists.
With more physicians per capita than any city in the state of Georgia, Floyd's family medicine residents are able to draw from a wealth of resources.
There's all the specialists that a family practitioner could ask for. And having done it in the residency program, I know them on a first-name basis. I can walk down the hall and talk to the cardiologist and say, I've got a case, and without feeling like I'm interrupting their day, most of them will say, tell me what you got.
I feel like I know at least a handful of people in every specialty. So when I do have those questions, it's as easy as picking up the phone and calling some of them. And everyone that I've interacted with has been very open to that.
From a medical perspective, it's as good as a big city. And it's kind of nice because you know all the specialists because you work with them. So it's also has that advantage where you're not, as in a big city, you may not know all the specialists you refer to or know them well. Here you see them on a daily basis, so that's really nice.
Residents see a diverse group of patients in Floyd's Family Medicine Residency Outpatient Center. This thriving practice has 22 exam rooms, 2 spacious procedure suites, and 2 osteopathic manipulation treatment suites. The center also includes on-site lab and radiology services.
The facilities at the clinic are very, very nice. You have a lot of different facets of medicine right at your fingertips.
Kind of from cradle to grave we take care of, so that was important to have all of those different services here.
Being part of an unopposed program situated in a large medical community provides unique opportunities for Floyd residents to see cases they thought they would only read about in textbooks.
You get to see pathology that, especially in an unopposed program, that you actually get to be closely associated with, taking care of that patient's care.
The specialists are very quick to involve us when they find that abnormal pathology. They say, hey, come look what we found.
Shared experiences lead to a camaraderie among residents that extends beyond the walls of the clinic or hospital.
Even from day one on interviewing, everybody was very kind and personable, and it was just an atmosphere that I could see myself really fitting into.
Everybody here is wonderful, and we usually try to do something almost once a week, whether it be go downtown or go to somebody's house or something like that, so it really makes you feel like you're part of the family here.
Close-knit relationships are easy to build in a town marked by Southern hospitality and a bustling downtown filled with restaurants, unique shops, and where opportunities to gather abound, making Northwest Georgia an ideal place to make friends and settle in.
There's a real sense of community here, and I find it personally very rewarding because 1 month out of being here, I was shopping in Sam's, and I hear, Dr. Kinetic, you really helped my grandmother, and I just wanted to tell you thank you. And I was like, this is so cool.
Sitting in the center of a triangle that connects Atlanta, Birmingham, and Chattanooga, Rome provides all the benefits of easy Southern living without sacrificing access to a thriving metropolitan culture.
It does have the small town feel where you get that Southern hospitality and you get to know your patients, know the community, and get involved locally. But you also have the big city life less than 45 minutes away.
Floyd County is home to a rich educational tradition featuring Darlington School, a renowned boarding school, plus a rich culture that comes from having 4 colleges in your community. Northwest Georgia also caters to a wide variety of recreational tastes. The Rome Symphony Orchestra is the oldest symphony in the South, while the Rome Little Theater has been entertaining audiences since 1933. The sports fan isn't neglected. The Atlanta Braves Single-A minor league team plays in Rome, providing fans with an opportunity to see future and current major league stars for less than the price of a movie. Extended rest and relaxation is readily available when the opportunity is presented. Hiking local trails or canoeing our 3 rivers is easily available. And the breathtaking Smoky Mountains or some of the world's most beautiful beaches are only a short drive away. Combine these benefits with an outstanding cost of living, and it's easy to see why many residents hope to call Rome home even beyond their time in the program.
I actually signed a contract with the Floyd Primary Care Network towards the end of my first year. And so I was very happy with the opportunities with our family. We didn't really want to move anywhere, and so we found a great opportunity here.
Those residents who become permanent members of the Floyd family find that the vast experiences gained during residency provide for a smooth transition.
The Floyd Family Medicine Residency Program has really prepared me to practice. I was a chief resident my last year, which helped me really see the inner workings of the residency program and compare it to other programs, not just in Georgia, but in the whole Southeast. It's just hands down the best one that I found.
As one of the top healthcare systems in the nation when it comes to employee satisfaction, it's only natural that Floyd would also be home to a highly regarded family medicine residency program, where you can practice medicine, make lasting friends, and start or raise your family, all in a leading healthcare environment that is, as we like to say at Floyd, well beyond expectations.